Yes, Dr. Nagpal, hi.
Dr. Nagpal, can you switch on your video, please?
Yeah, hello, good evening. I'm just trying to do that. Getting into it. Yeah.
Great. Meanwhile, let's get started. Welcome to today's edition of Virus Decode, where we here at ThePrint have experts live on air to take your questions on COVID and answer some of the most common and pressing doubts that people have at this stage of the third wave and about COVID in general. Today, we're going to be talking about the mental health effects of COVID. We have with us Dr. Pratima Murthy, the head of psychiatry department and the director of NIMHANS in Bengaluru. She's worked with the National Human Rights Commission and also with agencies like WHO. We also have Dr. Nimesh Desai. He is a psychiatrist and the director of the Institute of Human Behavior and Allied Sciences. Additionally, we have with us Dr. Jitendra Nagpal, a psychiatrist at the Mulchan Hospital, specializing in behavioral disorders like ADHD. Along with our guests, we have our in-house expert as well, Abantika Ghosh, who's been doing some excellent COVID coverage here in India. And I'm your host today, Sandhya Ramesh. Welcome, Doctors Murthy, Desai, and Nagpal, and a warm welcome to all of our viewers as well. So as most of us might know, the government has announced in the budget speech that it's going to launch the National Tele-Mental Health Program with 23 mental health networks. This is obviously a step in the right direction, knowing what we know about how COVID has already impacted mental health everywhere. Before we begin with our panelists, I would like to ask Abantika to actually give us a quick summary of what the government has announced and what is going to be a part of this program.
Right. Thanks, Sandhya. So while it's true, COVID has impacted our mental health situation a lot, but to be fair, in terms of availability, access, and all of that, our mental health services were already pretty constrained. I mean, we didn't need COVID for that. Having said that, so today the Finance Minister in her speech announced the setting up of a national tele-mental health program with 23 institutes of excellence with NIMHANS, and we have Dr. Murthy with us to tell us more about that. With NIMHANS, being the nodal center, and Triple IT Bangalore providing the tech support for this. That was basically the announcement, and she started off saying that COVID has accentuated our mental health problems in all ages. So yeah, that was the announcement today.
Thanks so much, Abantika. Dr. Murthy, would you like to tell us a little bit more about the announcement as well as what roles NIMHANS and other institutes would be playing in this?
Thanks, Sandhya, and thanks, Abantika. I think like you mentioned, I think it's a step in the right direction. We also discussed just before this that before COVID itself, we had a huge treatment gap as far as mental health disorders are concerned. And depending upon the disorder that you're looking at, the gap ranges anywhere between 75% to 90% for conditions like psychosis, depression, anxiety, substance use disorders, and a variety of other disorders. COVID, of course, accentuated that. We have been discussing mental health much more in the last couple of years than we possibly done in the decades before. And this is an opportunity of trying to reach people through, especially those in underserved and remote areas of the country who might never be able to access mental health care services. We've all been discussing the shortage of trained mental health care professionals. We've already been training, several institutions in India have been training doctors in primary care, nurses, psychologists, psychiatric social workers, and so on. But still, the gap is very wide. So providing tele-mental health services, and this has been well demonstrated during COVID, that you can reach a large number of people through teleservices. And therefore, if you have trained counselors who can 24/7 deliver these services, they can provide counseling to people with mild disorders or with psychological distress, but quickly identify people who need more severe who have severe problems and need to be identified as specialists, quickly make sure that they reach the specialists. And that's the role of the COEs to train these counselors, to mentor them, and to make sure that specialist help is available, either through individuals who will provide this service or facilities which offer psychiatric care. So if we develop this continuum of services, you might also be aware of the Mental Health Care Act, which has stipulations on the rights of people with mental illness. So when you look at all this in a continuum, we'll possibly be able to put little interventions that have been occurring in a vacuum together to have a comprehensive set of services for people in our country.
Thank you for that detailed explanation, Dr. Murthy. Now, also to understand why we would need such a network in the first place, Dr. Desai, could you actually tell us maybe what has happened in the last 3 years and why it is, what is the expected human behavior, and why is it that we're seeing such a variety of mental health effects? What is the pandemic doing to our mental health?
Thank you, Sandhya. As you raised correctly, and Dr. Murthy said, our transitional society with the rapid change has already had amounts of psychosocial distress and the need for counseling emerging. What the epidemic did was of agenda. Two, there was a whole lot of efforts by various agencies to provide psychosocial support and counseling. Mainly through teleservices. What this proposed program, I'm sure will do is synchronize and uniformize that for the masses. It's always been the issue that even if we can't provide the full range of mental health services, as was said, to everybody, let's begin at the major end of the large masses who cannot pay for these services and the counseling services, which might well be seen as the first initial step of reaching out for mental health services. As was said, from there, people who might need specialist care be identified, the other severe needs be identified. And so the nuanced approach to mental health service through teleservices is a huge step forward. Beginning with what happened in the early part of the epidemic, the telemedicine guidelines by the Medical Council of India and the Ministry of Health. And so this is really going to be so good if we can maintain the quality across the nation. And I'm sure that will be done.
That's actually good to know, and it's very hopeful that it would be implemented well. Dr. Nagpal, could you tell us a little bit about your on-the-ground experience dealing with patients? What kind of disorders or mental health effects are you seeing a spike in, and why do you think that is?
Thank you, Sandhya. Wonderful to hear about this investment the country is making. And what Professor Pratima ji and Dr. Desai Sahab has mentioned, I think it is a great leap for India. It may be a step for the country, but it is a great leap for the policy making. A huge investment in terms of reaching out. So far, though the work has happened phenomenally since the National Mental Health Program, right from 1982, but we see a major treatment gap. We see the mental health gap in terms of well-being in the community and the services provided in a more localized manner. We need to decentralize it, demystify it, and the stigma also associated with it. It is right that it has been thought of many, many years back. COVID-19 has been a turning point. It has been, fortunately, a moment where thinking patterns changed towards reaching out to the common man and hasten it up also, expedite the process. Because community mental health is the need of the hour. It has always been thought of. Now it is the urgency of the hour. We need to reach out. For example, I'll tell you, the current data about children in India talks about 3 to 4-fold increase during the COVID-19 of anxiety spectrum, depressive spectrum, the rate of suicides having gone up. The NCRB report talks about 11,000 suicides in universities per annum. That's the average coming up. Now that's horrendous. We are stuck up with the tertiary care demand. The psychiatrist and the psychologist, obviously, the number in paucity, very less numbers compared to the demand. So suppose now the teachers are first aid counselors. We have the medical officers as counselors. We have the community reaching out through telemedicine. And such a linking would be fabulous for all of us together to become more community-based, community-oriented, and community helping. beyond the walls of the hospital, beyond the walls of the institutional settings where long-term patients are there. Reaching out also helps in majorly to reduce the stigma. So COVID-19 is actually helping all levels of mental health care, the primary care, the early identification, intervention, and also the tertiary care services. And I certainly would say that children, women, elderly people, disability sector, special populations in our country hardly were able to access right time, right place, the right mental health services. So for me as a mental health professional, I think it's a great amount of relief that we are able to reach out with easier method, telecommunication, a large number of population, both in terms of building manpower, second in terms of utilizing that manpower to be the support for mental health care, involving the non-mental health sector for mental health care, like social justice, like the Ministry of Youth Affairs, why not? We look at women and child development. So telemedicine or psychiatry or reaching out to the common man is not just one institution's work. So with an institution like NIMHANS at the forefront, it will be wonderful to see this dream being realized. And I think the day is not too far where community crusaders or community warriors in mental health will be enough, because the mental health support system from the professionals number has always been less and will continue to be. Of course, we are building up on good manpower as we see more and more professional institutions coming up for producing psychiatrists and clinical psychologists and counselors also. So in a way, I think it's a moment of celebration with this announcement in the budget.
Yeah, and it's great that people are now becoming more aware of mental health issues. People are talking about it a lot more. And like you said, COVID has definitely facilitated that. And we can see it in our day-to-day interactions as well, with people inquiring about everybody's mental health also. Speaking of which, actually, Dr. Murthy, could you tell us a little bit about the helpline that NIMHANS had launched? It was one of the earlier helplines, and I know that it was immediately just bombarded with calls. How was it like? At what point did NIMHANS launch it? And how was it received? And how has it grown over the past few months?
Yeah, so I just wanted to say that NIMHANS has had a lot of experience in running various kinds of teleservices even before the COVID. So we had the NIMHANS Digital Academy, which has for the last few years been training professionals, particularly non-mental health professionals, in the basics of mental health care. We've had the Tobacco Cessation Helpline, which has provided counseling for people with tobacco use disorders. So, and colleagues have been involved in isolated efforts like this to provide mental health. I think it was the COVID pandemic that, as Dr. Nagpal said, they put it all together, and the psychosocial helpline was initiated at NIMHANS at the beginning of the pandemic in early 2 years ago. And since then, the psychosocial helpline has received nearly 6 lakh calls. And in different waves of the pandemic, there were different reasons for people calling. In the early phases in the first wave of the pandemic, it was predominantly around fears about the virus, uncertainty about what was happening, what were the symptoms of COVID, what was the kind of misinformation that was happening on social media and other platforms. So people seeking information. But in the second wave, a large number of it was around grief, around losing family members, having them hospitalized, people having been hospitalized themselves, concerns about children going back to school, some concerns about working from home. So these were the kind of concerns that came in the second wave. On an average, the psychosocial helpline was receiving about 10,000 calls a 10,000 calls a month, with peaks in the first month of the pandemic and during the second wave of the pandemic. So it's predominantly people trying to get information, and that's sad. I mean, the fact that people cannot access the right kind of information is another thing that we need to be aware of in our country. But just the fact of talking about problems, having somebody listening to them in a supportive manner, providing them simple, ways of handling these go a long way. I also wanted to point out that the government is going to start the health and wellness centers. So, there's a spectrum that you need to develop. I mean, the most important thing for all of us, and I think it's very important to remember that we can all develop resilience. Basically, good ways of protecting our mental health, of coping with stress, which is something that's going to happen. Now it's COVID, another time it's something else. So we need to learn how to deal with stress and how to feel calm and how to control our emotions, thoughts, and feelings. So right from health and wellness centers to this kind of helpline, like the psychosocial helpline that you mentioned, I think we need to develop a continuum of services. The psychosocial helpline has been remarkably useful during the COVID, and people have been very, very positive. And that again is an inkling that having a mental helpline, especially in each state. Now, we know that in our country, there's so many differences in terms of language, in terms of social context. So it would possibly be better. And health, of course, is a state subject. So it makes a lot of sense to have states and union territories have ownership of these and have these centers which are in or around those states to provide the services. So hopefully it will really look at cementing these linkages, developing and cementing these linkages so that people can get a wide variety of services. And this being a free counseling service, hopefully people, especially from more deprived areas, as well as anybody, would be able to use it without any worry. Dr. Nagpal also mentioned stigma, which is another very important thing that a helpline like this can overcome.
And like you said, it's a testament to how, if there is an option, people will avail of it and make use of it. And also the fact that you did not have a peak during the third wave in the calls is also a testament to how effective the vaccines have been.
Absolutely. And in fact, I'm glad you mentioned that, because vaccination anxiety was yet another issue for which people call. So, I mean, but as you rightly said, I think it's been wonderful how things have actually come under control. And I think it also speaks well of the fact that as a society, we also need to be resilient and help each other. I mean, it's not only about having formal services, like helplines or treatment services. It's also about, increasing compassion and care amongst people so that you're supportive to each other, especially for psychological distress.
Yeah. Abantika, could you actually walk us through, could you give us some stats? What is the mental health burden in India and how has it changed during the pandemic?
So I don't have ready statistics on how it has changed, but I have some numbers from before the pandemic. There was something called the state level disease burden study. So this actually estimated that 1 in 7 Indians have, some sort of mental disorder, depression, anxiety, schizophrenia, bipolar disorder, one of this. And one number that is very important in the current context that, this telemedicine thing is that there are, and our experts can correct me if I'm wrong, there are less than 1 psychiatrist in the country for every 1 lakh people. And, that apart from everything that we add in the mix, stigma and all of that, even of educated people have a problem, leave alone a psychiatrist. You can't even take them for counseling because the instant response is, am I mad? Do you think I am mad? So that's the kind of outlook we have towards mental health. And given that situation, the shortage of psychiatrists has really sort of complicated the mix. But having said that, one thing I would like to ask our experts, and this I have been thinking since morning, since this was announced, a lot of, counseling is one thing, but a lot of thing about psychiatric treatment or mental health sort of care services is the doctor-patient trust. How much do you think that can be achieved over a remote, tele facility? Dr. Desai, if you could talk about that.
Sure, Abantika, thanks. Let's remember that, like you highlighted and Dr. Murthy and Dr. Nagpal said, the proportion of people not reaching any mental health service in this country has been huge. What's technically called the treatment gap, anywhere between 70 to 90%. And your update about the estimates is quite right. 1 in 7 or 1 in 10 persons might need health. Now, the thing about the issue of tele-counseling, creating rapport or not, is a valid one to arise in your mind. But let's also face that one of the positive spin-offs, and I really think there are quite a few, one of the positive spin-offs of this epidemic, sadly, to recount, is that a lot of people, including the so-called average citizen and person, has become more comfortable with digital technology. How many of us would have possibly had such a session all on virtual? And so in small and big ways, a lot of people have felt comfortable in these 2 years about using digital technology and interacting in the virtual world. The second, I'm sure that the program will have provisions for identifying people who might have discomfort there, who can always seek in-person help. And three, a lot of telemedicine and telemental health services will also have a backup. So if there is a local person available who can then be the go-between. So really, I see a lot of potential for utilization here. But the nuance there is about, as Dr. Murthy had said, and that's perfectly fine in a sense, was okay in the initial part. A lot of calls at those helplines were about information seeking and logistics. Now, I would really be, and I'm sure my two colleagues will agree, especially NIMHANS colleagues will agree, that there is a need to, now is the time to tease out the varying nature of calls. Information, logistics, reassurance to a little higher level of counseling required. And so as the program evolves, I'm sure that will happen, including your concern about those who might not feel comfortable. That will be woven into the program. But surely, to repeat one more time, the issue of stigma, the issue of access and availability and utilization of services, the availability of specialist mental health resource for in-person consultation are all good enough reasons besides the post-pandemic effects to conceptualize the program that's been launched.
Thanks, Dr. Desai. And with that, I think I'm going to start taking some audience questions. So one of our viewers, Sankal, asks, in a hand-to-mouth country like India, mental health is seen as a luxurious, quote, problem. Affordability is an afterthought, need is recognition. Employers do not see this as an issue. How can we change this? Any of you, please feel free to take it.
I feel tempted
it's a big, sorry, please go on.
Go ahead.
Please go on. No, please.
So Sankalp, I just feel tempted to take that question, particularly when you have a hand-to-mouth existence. I think mental health is extremely important. Imagine how it can impoverish a person if a person who has to go on to daily wage is depressed and unable to work, what consequences it has. So I think we need to start realizing that mental health is very, very critical, not just to our overall health, but to our productivity, to our economy. Then therefore, it becomes extremely important. It is certainly not a luxury. It is a very important thing. There is enough research to suggest that there are socio-economic determinants, socio-cultural determinants of mental health. And, poverty is one. And therefore, I think we need to take this very seriously and make sure we pay attention to mental health. Dr. Desai, over to you.
Thanks. To continue from there, really genuinely, for valid reasons, it's been a huge myth in Afro-Asian countries for tangible and intangible reasons that because psychiatry and mental health services developed in the so-called developed or the first world, mental health issues, especially for the middle and the lower classes, do not matter. That myth really needs to be broken. As Dr. Murthy said, indeed, it becomes much more crucial for individual, family, that group, and the national productivity to see that issues of economic deprivation are handled appropriately by correct policies, but also by mental health services. And that is where, like I said at the outset, this kind of network of services being available for the masses, and I don't mind saying this ad nauseum, as I've been saying very often on many platforms, when all is said and done, people who can economically afford will get their services. Let's face it. It's for the millions and the masses that a public funded program like this with a wide network reaches out for a soft area like counseling. Indeed, we must all thank, and I'm sure we all do, three of us, thank Sankalp for bringing this on the table. Because like him, there'll be millions and millions of people who will consider this as a no issue at all. But that's the first myth that needs to be broken.
Yes, sir. I'll just add a point. Wonderful. I think you said rightly, sir, Sankalp has given us a food for thought on a very broad platform to think about decoding the word mental health. I think essentially what he's trying to also tell us is that mental health is not just about absence of mental illness, which we all have been debating, talking, sharing. A lot of it is about an individual realizing one's own potential, one's own abilities, ability to cope up with the day-to-day challenges of life, the resilience, what Professor Pratima was mentioning. And third point, I think an individual who can work productively. It could be any social, economical state of mind or state of environment. The mental health component applies to each human being. So today, when we have a conversation in the air with such multiple, multicultural, multi-stakeholder, interministerial dialogue on mental health happening, I think the outreach is expanding and the visibility of every citizen, whatever may be the economical strata, having the need to take care of one's own mental health in a broader scope, not about absence of mental illness. I aspire to be happy with a gratitude, do best what I can in my day-to-day life, and have the insight to seek help. What Dr. Desai is probably saying, the ability to go out and tell even the close friend of mine or a cousin of mine or maybe even a teacher in a school that, hey, listen, can you listen to me once? That caring, compassionate listening is what the telepsychiatry can do a lot, apart from only diagnosing illnesses and helping them. So we are looking at this is not utopia of mental health. This is reality that working at all levels, both with community partnership, professional partnership, and multi-stakeholders from the industry also. Why not from the media, the cinema? We have seen so many film actors being advocates of mental health now. So many media persons coming forward. So if it is a jargon, if it is a communication at home to home, then it should come more to every strata of the society. It will actually minimize severe mental health conditions. We come to understand from our teaching institutions that nearly majority of all the major mental health disorders begin sometimes around 14 to 16 years of life. So early detection in school, colleges is so crucial, early identification. So that's possible on the outreach. And I think every citizen as a crusader of mental health in institutions, whether educational institutions or teaching institutions, will gradually come in large numbers. I think that will really work. Thank you, Sankalp, for that question also. Yeah.
And Dr. Nagpal, if I can just add, I think it's also about changing attitudes to mental illness. I think we are it's not only stigma about getting help, we're also stigmatizing towards people who have mental health vulnerabilities. And I think talking about it, making it more open will improve attitudes and reduce that kind of stigma as well.
True.
Yeah, I was just going to say that we can already see that at least among the younger English-speaking urban population, the stigma has come down a fair bit. With the previous generation, it was much different. But my friends, people exchange notes about what their therapists say, and it's become a very open topic of conversation. And we can only hope that with COVID and also with the launch of the mental telehealth program, that this sort of removal of stigma and just a comfortable mentality will slowly also spread through various socio-economic strata as well. Before we close off, I would like to take one last audience question. Shruti asks, in the US, we are seeing a lot of long COVID patient reports with anxiety, sleep disorders, and PTSD and effects like that. What do the experts have to say about that in India? Are we seeing cases like that in India, neurological effects, mental health effects induced by long COVID?
I think it's worth recapitulating briefly that post-COVID or long COVID is a mixed bag. There will be neuropsychiatric complications which might actually be related to brain functioning. There's, of course, the possibility of depression and this related spectrum, direct effect, or the economic slowdown, or the trauma, as Dr. Murthy was saying. But there's also the possibility of the socio-economic factors besides the economic slowdown that might affect. But I must say here, as assertively as possible, that PTSD has a huge cross-cultural variation in terms of frequency. And there's very good data from last 25 or 30 years in this country and elsewhere. So we don't really need to end on a reassuring note. The largely hyper arousal state of PTSD is something that our cultures have fortunately protective mechanism about. Like Dr. Murthy had said, the inner resilience, societal, family, individual level. But surely the neuropsychiatric and the psychosocial long COVID complications is something that we will all have to be aware of. People who have come through COVID, which is majority of us in one or the other manner, or people around them, and of course the professionals. And the counseling help program will surely address the post-COVID needs very well.
Of course, and also we don't know much about long COVID just yet. We are just starting to get
We're all learning.
data.
We're all learning.
Yeah, only
Absolutely.
very preliminary scientific results have even been published.
Sure.
Yeah, and with that, we've actually come to the end of this program. Thank you so much to all of our guests for taking time out and joining us today. And thank you also to our viewers for tuning in. We hope the session was extremely informative to you.
Thank you, Sandhya.
And
thank you very much.
Thanks once again. Please do join
Pleasure.
us
Bye.
again for tomorrow's episode.